Okay. Hey everybody, my name is Shelby Blankenship and welcome to the MMOA podcast brought to you by ICE. Just wanted to give you a few tidbits on live and online classes that we have coming up, and then I'm going to dive into our topic today. So for live, we have February 4th and 5th in Beaverton, Oregon, February 11th and 12th in Sparks, Glencoe, Maryland, and February 18th and 19th in Kewanee, Illinois. Those last two only have one ticket left. So if you're interested, definitely hop on that nice and quickly. And then for online, we have Essentials Foundations that's going on currently, but our next cohort starts March 1st. And then for Advanced Concepts, it's May 4th is the next one. So if you want to get both of those in, I highly recommend signing up for that next Essentials Foundation. Then you can go straight into Advanced and then get your cert if you haven't done, or if you've done a live cohort. So going into our topic today, we're going to be talking about neuroplasticity and going into quality of movement versus intensity. There tends to be a lot of discussion amongst PTs on which one is the most important for our patients, and sometimes some of our therapists tend to focus on one more than the other, and it can get very frustrating when you're trying to pass off your patients to somebody else or anything like that. So I used to work in acute care, and one of the biggest things for our neuro patients was making sure that they had the cardiovascular endurance to tolerate inpatient rehab. So HIIT training was super, super important. So when I ran across this CSM presentation in 2021, I just thought it was super cool and I wanted to share it with y'all. The title of the work that was done was called Trouble Removing the Kids' Gloves. It's just savage. I love it. Strategies for implementing HIIT. And it's not just in outpatient or home health. It's in inpatient rehab. It's in SNFs. It's in acute care. So this definitely applies to all the continuums of care and will be super important to make sure we have consistency. So one of the things that they looked at is that a lot of people with neuroplasticity kind of focus on the three components of, I wrote them down to make sure I got them right, specificity, repetition, and intensity. And especially when it came to walking, this was one they really wanted to focus on. So there was lots of different studies and lots of things that they researched. I highly recommend you looking at their talk if you get a chance. But one of the things they really emphasized with their patient caseload is getting them walking 4 times a week as far as they could and as long as they could, getting their heart rate up to that 75 to 85%, and then always factoring in those barriers. So something like facility barriers or individual barriers, or if they had to wear an AFO or any of those kinds of things, keeping them safe. So there was one patient in particular, when they first started out on week 1, they were using 4 people, which isn't always doable, but it's just something cool to think about, is that this patient went from being dependent and unable to perform a 6-minute walk test, unable to do stairs, was max assist with the FEMS score, and their Berg score was a 5 out of 56. By week 1, with 4 sessions per week of constantly walking, they had 4 people. They were just making this man walk as far as possible. They were using whatever equipment they needed and basically just going to his tolerance, which was 7 to 20 minutes, depending on the session. He was able to go from max to mod assist in the FEMS score, was able to take 12 steps on stairs with max assist, went from unable to do the 6-minute walk test to 114 feet with a hemi walker in max assist. And then on Berg, he went from a 5 out of 56 to 11 out of 56. That's just in 1 week of HIIT training. Then you go into week 2. They do the exact same thing. Push him as far as he can tolerate, and he was able to consistently go over 20 minutes. He became min assist with almost every single one of those scores that you just heard. He went from an 11 out of 56 on his Berg to a 28 out of 56. By discharge, he was mod-I to independent, and his Berg score was a 48 out of 56. And this man had had a very severe stroke. So This is all to say, this is definitely an and situation, not an or situation. You want to make sure with your HIIT training, whatever activities that you're doing, that you're getting that heart rate up. So many of our stroke patients and so many of our just patients who have neuro or just geri in general just aren't getting that cardiovascular input. And so there's just no blood flow to the areas that they need the most blood flow in. So if we can promote that blood flow, get their endurance up, we set them up more for success when they go to the next thing, whether that's outpatient home health, inpatient rehab, or simply just going home and being able to do their normal daily activities. So I hope this was a good talk for you all. I hope you learned some things. I highly recommend looking into this talk. Again, I'm going to repeat it again because I want to make sure they get all the credit because I thought it was really good. It's called Trouble Removing the Kid Gloves, Strategies for Implementation of High Intensity Training. And they go through multiple studies and all different kinds of barriers that they had at their facility or that you could have at future facilities and the equipment they use to measure heart rate and those kinds of things, which was really cool. So I hope you guys have a great rest of your day and hope to see you at the next MMOA class. See ya.